So, Isabel, you have been doing biological decoding for how long and dental decoding?
About roughly 3 years. I've been doing, so I'm gonna share and I'll talk a little bit about what I do and
Mhm.
what what brought me here, basically. So you understand a little bit of where I'm coming from. So
Good.
I'm gonna share my screen so you guys can see I guess I need
I
permission
need
for
to
that.
give you powers, as Fabian would say.
Yes, I do need the power.
He's like, give me my magic powers. Give me 1 second. Oh, there you are. There you go.
Okay, so let's see. Are you guys seeing that?
Yes.
Mhm.
Okay, very good. So I want to thank everybody for being here and for joining me on this topic that is really passionate for me. I've been a dentist for 25 years now. Started as a conventional dentist, and now I am a holistic biological dentist. And I will explain a little bit about what that is. But today we'll be discussing about the emotional roots of bruxism and how our mind and our body are connected, and how everything that happens to us in our mouth is connected to the rest of the body and vice versa. So what's happening in the body manifests in the mouth. I am Dr. Isabel Perez, and I am from Colombia originally. I was born, raised in Colombia, moved here in 2001. I did a residency in Jackson Memorial Hospital in Miami. And I decided that I was helping my patients, but there was something missing because I was implementing everything that they taught me in school, but it's still, there were things that I was not able to help my patients with. And there's a particular case with this patient that she was having ulcers in her mouth. And I was giving her all the different things that they taught me in school, and she was still not getting better. And I was just trying to help her. And I was seeing her like 2-3 times a week and trying to help with these lesions. But the problem that she was having was not originating in the mouth. And as I started learning more and more, I just did a PhD in integrative medicine because I felt that I needed more tools to be able to help my patients, and realized that it was a systemic condition that was showing up in her mouth. I am also a certified coach. I'm a Reiki master. I do body decoding and emotion and body code. I do dental decoding and biological decoding and family constellations, trying to figure out what it is that we have to go through to be able to learn all the things that we need to learn in this life to be able to evolve. And the more I learn, the more I know that I don't know anything. And the more I learn, the more I discover that we are all in charge of our own transformation. And I'm here just as a guide. I'm here just to provide information that I've collected over the years. But every one of you is in charge of your own transformation. And the most important part is that we need to become aware of what it is that our body is trying to communicate to us. But we won't know what it is, this language that the body has for us, until we learn the information. And how do we learn the information? By listening to our body and also learning about dental and biological decoding. And then on top of that, we're going to find that our ancestors have a lot of information for us. One of the things that I actually recently learned is that we are here, we're light beings, we're spiritual beings having a human experience. And we come into a family to share these experiences with and to learn similar things. And that's why we experience similar things than our ancestors experienced. So they are kind of a mirror that we need to look and see what it is that this ancestor had to go through. And am I sharing the same story? Am I sharing the same conflicts? So for me, oral health is kind of the beginning of this roadmap, the wellness roadmap. And why do I say this? It's because we have a lot of information. As I said at the beginning, there is a lot of manifestations of what's happening in the body that are showing up in the mouth. And then there's a lot of things that are happening in the mouth that are affecting the rest of the body. Every single patient that we see in our office, we do a sample of their plaque. So we scrape their plaque, and then we look under the microscope. When we look under the microscope, we see the kind of bacteria that they have. And there's some bacteria that are more aggressive, and we can see how they start attacking even white blood cells. The white blood cells are the cells of our body that are defending our body. So if these bacteria that are really aggressive are attacking those white blood cells, what is happening in the mouth? But the most interesting thing is that we found, like, for example, amoebas in the mouth. Amoeba is not supposed to be in the mouth. This is something that is in the digestive system, but we are seeing it in the mouth. So what's happening in the systemic body when we're seeing this type of aggressive bacteria? We have found, for example, spirochetes is a really active, aggressive bacteria. And they have found spirochetes in the brains of patients with Alzheimer's disease. So if we look at what's going on in our mouth, then we can start trying to figure out what is happening with the rest of our body. So if someone has digestive issues and there is a lot of bacteria in their mouth, imagine you're swallowing this saliva multiple times a day. What's happening, that microbiome, especially if it's an imbalanced microbiome in the mouth, that's going to your digestive system. It is definitely affecting the rest of your body. So then we will start looking at what's going on in our mouth. Do I have bleeding gums? Do I have bad breath, halitosis? Do I have inflammation? Do I have decay? All these different things that can happen. But then a lot of the times you go to a conventional dentist and they say, oh, yes, you have a cavity. Let's just fill this. But why did you get this cavity to begin with? And there's multiple reasons for that. One of the things is that we will always find an explanation in the physical level. We can always find an explanation in the material world, but there is something behind that that is also causing problems, and that can be that psycho-emotional state. How is it that our psychological and emotional state is? Is it balanced? Are you going through a difficult time in your life? Then we go and look at that ancestral information, that epigenetic information. This is just imagine this road that you're going towards happiness and longevity. So we have to go through all these different towns to be able to achieve that. And sometimes I say to my patients, if we start in the mouth, we can find a lot of information that can make this pathway a lot easier, because a lot of the information is stored in our subconscious mind, but our teeth have a lot of this information. And if we learn how to decode this information, then we're going to have an easier pathway. It's not a simple journey, as everybody probably has already realized, but we have to go through all these different towns. We need to go and just look at those limiting beliefs and then change and rewire our information, rewire that limiting belief that we have from the beginning that is installed since probably we were 2-3 years old, very early in life. So we need to start doing a lot of work. If we're 50 years old, 48 years old, 60, imagine all those years. Those neuronal pathways are really, really ingrained in your brain. So we need to start tracing these new pathways. And then we need to have personal connections. We need a tribe. We are social beings. We need to have connections with people. We need to have connections with people that raise our frequency, raise our vibration. And then also we need to take care of that physical body to be able to get to that point. Dale, do you have a question?
Yeah, this is maybe going off the subject a little bit, but it's something that I find really interesting that may actually have a relationship. So I've recently been reading a book. It's called The Radical Approach to the Akashic Records. And one of the things that I'm actually finding is that there seems to be, multiple patterns and multiple mechanisms that get affected by any psychological trauma that we have. You can do biological decoding, you can do dental decoding, you can do this. And I'm actually starting to believe that that actually is something that is also in your Akashic records, that there are all these different parallel mechanisms that you can use in order to approach it. It's almost like another tool in the tool bag. So I was just wondering, did you have any thoughts on that? Because I just found that fascinating, something that just came to mind, and it just seemed like it's kind of almost related to this, but kind of not.
I love your question, because the thing is that not one thing can help one person. And something that is going to help you might not help somebody else. It is what resonates with you. And then we go to the limiting beliefs, right? Because if you have a belief, for example, someone that is very religious, and if they think that Akashic records or transgenerational ancestral information is not kind of aligned with the religion, that's not going to work for them.
Right.
So you need to be, yes, it is good. And as I said at the beginning, I've been collecting all these tools and putting them in my toolbox. Sometimes I use them all in different occasions. Sometimes there's patients that they need certain things. And maybe there's some other things that don't work with them. It's a lot of information. And that's what it is. But what do we do with the information is what's going to cause the transformation. So then, yes, the information that is in the Akashic records can be really valuable. But what are you going to do with this information? It's one of the reasons why I became a coach. The thing is that when we do decoding, we start finding all these different conflicts, all these different traumas, all these different events. And it seems that they don't stop. It seems that you find, it's like the onion, and everybody talks about how you start peeling the onion and find different things until you find this beautiful core. But I noticed that the more I look for, the more I find things in there. But if you start kind of having, and I like data, and I like to have, I love Excel sheets, and so I'll do all this information. So then when you start compiling all this information, you're going to see that there is a theme in this conflicts. So then that's going to start narrowing down, and then kind of, okay, well, maybe I'm not going to go to this town in this roadmap, because I already know that I worked with this. So I'm going to go to the next one. What are we doing here in this life? We're evolving. We're trying to move forward in our evolution. So whatever works for you, and if you're applying it and using the information towards that evolution, it's going to be amazing. And it is all energy, right?
Yeah.
Our emotions, our thoughts, information is energy. Food is energy. The goal is to use things that are going to raise your vibration. And your vibration is going to be raised differently than probably what's going to raise my vibration. So whatever works for everybody, go ahead and use it. And information is powerful, right?
Yeah.
So what exactly it is that we're talking about, because a lot of people don't know what bruxism is. Bruxism is actually an involuntary act. It's something that we normally do without paying attention. So it can be done during the day. It can be done at night while we're sleeping. I've been experiencing that myself during the day because I wear a mouth guard, and we'll talk a little bit about that towards the end. But my teeth were sore. It's like, why are my teeth sore? And then for some of you that probably know about dental decoding, the front tooth, the upper right front tooth is connected with the father figure, the role model of father, that role of the father. And I was just clenching my teeth, and I realized that I was doing that before I was going to numb my patients, because I didn't want to hurt them. So I was just kind of clenching my teeth. And I realized, okay, when am I clenching? So I started paying attention. Your teeth are not supposed to be making any contact at all unless you're chewing. So I'm going to repeat that. Your teeth are not supposed to be making contact unless you're chewing. Even if it's a little tiny contact, like if I start tapping my arm like this, very gentle, it's okay, it's not gonna bother me. But if I do this the whole day, several days, I'm gonna end up with a bruise. Same thing happens with our teeth. If we start tapping or even squeezing harder, that's the clenching, or grinding, that's the movement, side to side movement, then we're gonna cause wear on the teeth. So some of the things that we see, and I see a lot, I'm thinking a big percentage, the research says 47% of population has bruxism, but what I'm seeing in my practice is higher than that. So maybe the 47% is reported, but what I'm seeing is definitely higher because I see wear on their teeth. A lot of people, when they're clenching really hard, they get headaches, they get earache, they get jaw joint pain, muscle pain, especially on your neck. Then the gum starts receding. That's another sign of the bruxism. Tooth sensitivity, fractures, that's a big one. A lot of people say, oh yeah, I was eating something hard and my tooth broke. But a lot of people say, I was eating a soft bread and my tooth broke. Why is it that the soft bread caused the fracture of the tooth? It's because there was already a fracture line on this tooth. And then a lot of people, they wear it so much that their teeth they look a lot shorter, or they even have loose teeth. I had a patient a few months ago. She is in her 40s. The tooth was completely healthy, not a single filling on that tooth. And the tooth was moving side to side. And it was because of the trauma with the grinding. That was a tooth that was making the highest contact in the arch. And she lost that tooth. So I want you to look and see if you have any of these signs in your mouth. If you have the wear facets, some of them have fracture lines, just the little lines. If you have recession, the gum starts receding. Those are signs of bruxism, clenching or grinding. The fracture lines, pain on your jaw, pain on your muscles. Not necessarily that you have to wake up with pain, but that tenderness. And I want you to do a little test. So if you put your fingers, and maybe 2 fingers on your cheeks, and you contract or clench your teeth, you're gonna see a change in your muscle. So that change, if it's small, the difference, if the difference is small, then that muscle is probably normal. But if the difference is really big, that muscle is having an overactivity. It's hyperactive, and that's developing the strength of that muscle, causing even more problems. And that's another sign of the clenching and grinding. So how many of you are experiencing that?
I am.
Mhm. Yes.
I am.
I think that, as I said, probably 80–90% of people. So then we're looking that there's different reasons for the bruxism. And as I said, we look at the physical, but then there is more information behind the reason why we're clenching our teeth. Do you have a question? Okay. And then, so what is it that we're ignoring? There's something that we are missing. And is that connection with the rest of the body? And is also the connection with what we are thinking and what we're feeling. So there is something that is called PNEI, and I don't know if you guys have heard of it, but it's psychoneuroendocrine immunology. So it's a study that is just showing how our thoughts, which is the P, the psychological, including the emotions, are going to start changing the nervous system. So if you're overthinking something and stressing about something, your nervous system, your sympathetic nervous system is going to be activated. So what's going to happen if you have this for a longer period of time? Your endocrine system is going to be having an effect. Your cortisol levels are going to skyrocket. And if you have this for longer periods of time, then your immune system is going to be affected. So then they found, a study published in 2019 found that individuals that grind or clench their teeth, they started to have elevated levels of cortisol and the stress, which is the stress hormone, and their heart rate changed before they were clenching their teeth. So they put monitors on their muscles and they put monitors on their heart, and they noticed that the levels change before the bruxism. So how is that possible? Well, what was happening before, right? What was happening on this first letter, the psychological? What were the thoughts that were going through before this person was clenching their teeth? Something interesting in there to consider. If our vital signals were changing before we were having the habit, that subconscious habit. There is a doctor, she's a research in the American Psychological Association. She confirms that the mental health issues are reflected in the body and as physical symptoms. So we need to consider that stress is one of the biggest contributors for the bruxism and is one of the biggest contributors for these imbalances. But where does the stress usually comes from? A lot of the times the stress is coming from that fear of what's going to happen in the future, or is also coming from past experiences, those beliefs that we have. But then something that we need to consider is that there's a huge communication with what's happening in our mouth. There is this connection. We have blood supply. So we have the inflammation on the gums. And that's why it's so critical when we have a patient with heart conditions. If we're going to do a cleaning, a dental cleaning, usually these patients that have really complicated heart conditions, they need to be pre-medicated, because anything that goes in the blood supply can go directly to the heart. And what I was saying is that if there is this aggressive bacteria, and they have found this aggressive bacteria in the brains of patients with Alzheimer's disease, isn't this important to have into consideration, because it will be affecting the rest of your body? And one of the things is that a lot of the hormones are produced in the digestive system. And if our microbiome in the mouth is not balanced, it's going to definitely affect the digestive system. And at the same time, is that affect the PNEI effect is going to be causing problems in the rest of the body. But we need to go deeper. And where is this stress coming from? Usually is connected with our emotions. Usually is connected with conflicts that our body is manifesting at the physical level. Conflicts that our brain, our mind hasn't been able to resolve. So now our body is taking control and is showing us where it is that we need to start looking for. And here's where it comes, the relationship between the emotions and the teeth. So when we study the dental decoding, we will study that every single tooth is connected to a conflict, to an emotion. But also when we think about the traditional Chinese medicine, they're connecting every single tooth to a meridian in the body. The meridians in the body are these channels of energy. So when you go to an acupuncturist and you have problems on your liver, for example, they're going to put a needle on your hand. Your liver is not in the hand, but there is a meridian that goes to the liver that is located in there. And that's how you start treating those imbalances. A lot of people ask me, so what happens if there is a tooth that is missing? Well, the energetic pathway is still there. if there is a problem on a specific tooth, then don't you think that that's a sign from your body saying that there is something in there that is not balanced and we need to address? So we need to be thinking as more holistically. We need to be integrating all this different information as we were talking at the beginning. And one of the things that I'm passionate about, and that's what motivated me to do family constellations, is this information that we can carry or inherit or achieve from our ancestors. And a lot of that information is kind of imprinted in the roots of our teeth, the ancestral information. So teeth are the boundary between your inner self and how you express yourself externally. Isn't it beautiful?
Yeah.
The teeth are kind of the only organ that is at the same time inside and outside of the body. When you open your mouth, you're opening this amazing system to the world. And then when you're closing, you're able to keep things inside. This is that inner self. And we can discover so much information from our teeth. But one of the things that I'm really passionate about is not only discovering the information, either from the biological decoding or dental decoding, but discovering the information from yourself, from within yourself, because that's the most powerful. You can get, for example, I was working with someone yesterday that is dealing with excess fat in their body. Like she wants to lose weight. And when you are going to decode obesity or fat, there's like 10 different codes. Well, which one is the particular code for you? Mm-hmm. The only person that knows exactly what's going on is yourself. And one of the things that I teach on my courses is how can I learn more about what my body is trying to communicate to me. And I want to do an exercise if you guys want to play. Mm-hmm. I'll need you guys to get and maybe some of you have done this exercise, but we can go a little deeper with that. And I need you to get 2 pieces of paper, like 2 just little pieces. You don't need a big piece. Mm-hmm. And then you're going to write down on one of the pieces something that you really love. Only one thing. Something that you really, really love. It could be food. It could be a loved one, the name of the loved one. It could be nature. It could be whatever it is that you love. Then you're just going to write it in there. And then on the other piece of paper, you're going to write something that you dislike. Or maybe the name of someone that you're not happy with. And if you have done this exercise before, I want to challenge you to make it even harder. For example, if you're trying to make a decision and you don't know what to decide, then write down the question. Okay, for example, do I want to continue in my job? Or do I want to accept this offer? Or do I want to invest in this? Is this in my highest benefit to invest in this opportunity? So whatever it is, so put one thing that you're not sure about, one thing that you don't like. And then, so one is a quote unquote positive and negative. There is nothing positive or negative, but in this case, we'll play it like higher vibration and lower vibration. And then when you have that, I want you to crumble the paper, both papers. So you don't read what you have in there. And then you're going to just kind of switch them and just toss them, just change it so you don't have any idea of which one is which. I want you to use, and a lot of you can probably do muscle testing, and that's a really good way to find answers to some of the things that you're not sure about. But when you start connecting deeper with your body, you don't really need to do a lot of the muscle testing. You will feel it in your body. You will start noticing changes in your body. And that's what I want you to start recognizing on yourself. How does a positive thing feels in your body? Where do you feel a negative emotion? So you can grab one of the papers, and then if you want, you can close your eyes. And you can just kind of put the paper kind of on your forehead, and then slowly move it around your face, maybe near your mouth. And then put it on your throat. And see if you notice any changes as you move the paper throughout these different parts of your body. Some people can feel like a little tingling or like a warm sensation. Maybe like difficulty breathing. So those are informations that are very important for you to have into consideration. And then maybe just when you're ready, take the other paper and see if there is a difference. If you notice more calm, or maybe expansion of your heart, or maybe you feel nauseous, just experience what you're feeling. Just connect with your body. And then when you're a little more clear on the difference between the two papers, then just see if what you're feeling is what it matches with what you wrote. Meaning if you feel an expansion on your heart, for example, or a warm feeling, a pleasant feeling, or a calm feeling, just see what it is that you have in your paper. Does it say something that resonates with what you were experiencing? One of the things is I did this exercise with a friend, and she wrote chocolate because she liked chocolate.
Mhm.
But she comes from a family that is diabetic. So what do you think the answer was from her body?
No.
So for her, that was a positive thing because she was really happy with it. But her body was saying, it is not a good idea for you to be taking this chocolate. So it is really important to start understanding those messages that the body has for us. What did you get, Dale?
Well, I went backwards, so I'm not very in touch with my body, I guess. Because I went real simple. I went love and fear, and I was backwards, so I don't know.
Yeah, but that's a really interesting thing because love and fear are kind of the same point, but different sides, right?
Right, sure.
And for our body, sometimes we need to be a little more specific.
Okay.
And also what it is exactly that you were thinking while you were writing the message. That's also part of it, right? So
Right.
what
So I probably
thinking,
wasn't in it when I was doing it. I was more thinking about the exercise than the actual feeling. So when I wrote it, I was just writing weird words, and I probably didn't put the emotion into the words when I wrote them.
uh-huh. So I will encourage everyone to do this exercise when you're kind of in a calm environment and then with intention and see what happens. The more you do it, the more connected you're going to be with your body. And then you're going to get a lot more information from it. And then also the feelings that you are experiencing, if you connect with biological decoding, okay, let's say I'm having nausea. What's going on? What's happening in there, right? I'm having some tingling sensation in my body. So there is a lot of different information that comes from your body, right? So your body knows the way. And we should be listening to our body. We should be listening to our heart. So when we're looking at the different areas in our mouth, we're going to be connecting what's happening in the body, right? Or what's happening, what's the body trying to tell you. So I had a patient this morning, and he was telling me that he's been clenching his teeth, and he was having some sensitivity on the upper right, upper left. And then if we look here, the upper right, so when we look at the teeth, we look at kind of in reverse, as if we're looking from the inside of the mouth out. So this is the upper right, this is the upper left, and lower right. So the outward desires and that paternal connection. So it is with this side of the mouth. And then when we're looking at the upper left, is that sense of identity, that maternal side. When we're looking at the lower left, is home, is love, is relationships. And then when we look at the lower right, is connected with work and finances. And if we go individual tooth, every individual tooth is going to be connected to a specific conflict. In his case, he was going through difficulty communicating with his mom and his stepfather. So he was feeling that mom was not seeing him. He was feeling that he was invisible. And then he was having difficulty connecting with this stepfather. And that was showing up with the upper teeth. So there's multiple stories, and I know I want to be considerate with time. So I'm going to go like maybe just a couple of examples, because I want you to understand a little bit more about what it is exactly that this connection, this biodental decoding that I do is connected with. So this is Anna. Of course, it's not her name, and this is not my patient, but it's a representation of my patient. It's a beautiful story because she has been clenching. She broke upper left molar. She's been struggling with relationships. She had an infection on the upper left molar, and she had issues with that tooth number 14, the upper first permanent molar on the left side. So we had to remove that tooth. We had to extract that tooth, and we had to place an implant. But remember, we were talking about how everything can be connected to the physical. And in her case, yes, she was clenching her teeth. And why was she clenching? She was not expressing her emotions. She was one of those people that will stay quiet because she didn't want to upset anyone. When she was little, her mom was an alcoholic. And every time mom will come home, she was drunk and she didn't want to hear any noises. She wanted her daughter to be quiet. So she had to swallow everything that she wanted to communicate to avoid upsetting her mother. Then we placed this implant, and I didn't ask her anything, and that was my fault. Now I do that. Now I tell them what is the connection with the different conflicts. When I placed the implant, and I usually see them like 2 weeks after the surgery. She came back and the implant was loose. Just 2 weeks. The body didn't accept the implant. So I told her, okay, we're going to have to remove the implant. I cleaned everything, disinfected, and put just PRF. And what I do is I draw blood from the patient. We spin it in the centrifuge, get the PRF, this plasma-rich fibrin, and put it in there, which is building blocks of the patient to create new bone. And I said, I want to see you online or virtually to do dental decoding and biological decoding. So that's what I did. She cried a lot, and I gave her some homework to do, some things to release some of those conflicts and emotions. And about 6 months later, she said, I'm ready to do the other side, because she had another infected tooth on that side. So we removed that other tooth and we placed 2 implants on that appointment. She said, I have wrote letters to my mom. I did all my work. I released, because remember, that's the upper left quadrant, and she was a grinder. She said, I started expressing, and the expression is not only verbally, you can express the emotions writing. So then she said, I wrote everything. I wrote multiple letters to my mom, and I feel that I'm in peace and I'm ready. So now, after 4 months of placing those implants are ready to be restored. She met her husband now, they got married. She's having a family. Remember, that's the family, belonging to a family. That tooth is belonging to a family. It's also that number 15 was also affected. Is that injustice, that deception, that connection to family. And every single time I see a patient, there is more stories like this, and there's just incredible changes. And as I said at the beginning or earlier, is like what you do with the information is what's going to help with the transformation. So then this is another case, and it's an interesting because there is something that I share with him. I have an endodontia, like meaning my permanent tooth never developed on the area of tooth number 29. That's on the lower right, one of the premolars, and it's connected with frustration. This patient is a type A personality. He works with his wife, so he's not really able to say a lot of things because he doesn't want to upset his wife. So he stays quiet. He just kind of swallows things. And that tooth broke because a few days before this tooth broke, she was making decisions at work. They run a business together, and they lost a lot of money. So he was very upset. He had to swallow what he wanted to say to prevent bigger problems with his wife. So he was frustrated, and he was just clenching his teeth, avoiding to create bigger problems. And then there's more and more cases like that. So what I want you to think is, if you are a clencher, are you having trouble expressing what you want or speaking your truth? Are you kind of trying to just hold your breath so you don't say things? How often are you catching yourself thinking that you're doing something that you don't want to do, but you're not able to change things and express what your soul, what your spirit is really what wants you to do? So is there a secret in the family and you're not able to communicate that secret? And sometimes those secrets we're not aware of them. And that's when the epigenetic and transgenerational comes handy, that information of those secrets. Do you struggle feeling maybe helplessness, the feelings of helplessness or repressed anger? And anger is a big one for patients with bruxism. So what's happening in the mouth is telling us what's going on with our psycho-emotional state. Yes, there's reasons of imbalance. For example, if your occlusion, if your bite is not stable, the body is trying to look for stability. And that's another reason for the bruxism. But as we know, these physical imbalances are also having some information about our emotions, our psycho-emotional states. A lot of patients that are having a sleep apnea, for example, that they stop breathing in the middle of the night, they cannot breathe. They stop breathing for a few seconds, several times at night. A lot of the times they clench their teeth, and it's like an alarm from the body to send a message to the brain to tell the patient, you stop breathing, you have to breathe. So that's a physical message. But what is it behind that emotional? What is that message that is stored in the body that is making you clench your teeth? And we see that it's not only adults that suffer bruxism. We can see kids also with bruxism. So we learned that bruxism is connected with unexpressed emotions, unexpressed aggression, and it is often unconscious. Feelings of inability to defend oneself. And a lot of for example, secretaries that their bosses are telling them to do something and they're not able to fight back or to respond. They just have to swallow whatever it is that they're feeling, their emotions. They're not able to express themselves, or they have fear of losing that stability. And we go again to that stability. And it can be not only job stability, it can be in a relationship, financial stability. So there's many reasons for that fear of losing the current security or the stability. The kids usually between ages 6 and 10, they do have this clenching and grinding. Usually it happens when they're transitioning from the baby teeth to the permanent teeth. And it's kind of a natural way to stimulate the dentition, the growth. But then a lot of the times we have to decode the parents, because our kids, especially at those ages, they're absorbing this psycho-emotional state or the frequency of the parents, especially the mothers. So what do we do when we have bruxism? Especially with kids, definitely see a dentist just to see if there is nothing at the physical level. Because again, we can see that there are kids that their bite is not balanced, or they're having difficulty breathing because the space is very narrow, or they have a tongue tie and the tongue is staying more far back, blocking the airway. So every single patient that has bruxism should visit a dentist. And if it's a biological or holistic dentist, even better, because we learn a lot more about this integration, this connection with what's happening in the body with the connection with the mouth. Then for kids, having a little relaxation techniques before going to bed, talking to them, letting them express what they're feeling, connecting with those emotions is really critical. But as we know, this journey of discovering the conflicts and the traumas can be a long journey, and sometimes is a slow process because we have to do a lot of processing. So what are we going to do in the meantime? Well, we're getting to the root of the problem. There's different options. So yes, doing the dental decoding is a big part of it, and biological decoding. If you're having sleep apnea, and one of the signs of patients that have sleep apnea is snoring. So if you snore, I will encourage you to have a sleep study. There is a possibility that you're suffering from sleep apnea. And CPAP machine or devices that move the jaw forward to open up the airway can help with that. And one of the things that almost every conventional dentist does is recommend a mouth guard. And I want you to be careful with that, because if you are having a narrow airway and you have a thick night guard, this thick night guard is occupying space for your tongue. So your tongue has to go back to the airway space, reducing the space for the airway or the air to go. So then increasing the risk of sleep apnea. So there is different ways to know if the device that you have is helping with the airway situation. Yes, it's going to be helping with the grinding. It's not going to be solving and getting to the root cause. But in the meantime, to protect your teeth, a mouth guard would be an idea, a solution. Sometimes patients that snore, something like mouth taping, it's a good idea, because if you think about it, if you're laying down and your mouth is open, your tongue is going to go to the airway. But if your lips are closed, then the mouth is closed, the tongue is staying in a more forward position. I would not encourage the mouth taping for people that are having already difficulty breathing at night, or that they are waking up multiple times at night. Maybe try it during the day and then slowly start wearing it. But we should all be sleeping with our mouth closed, our lips closed. Lips together, teeth apart. That should be the new mantra for you guys. And the tongue in the roof of your mouth. Lips together, teeth apart, tongue in the roof of your mouth. So we need to embrace that emotional well-being or that emotional wellness. We want to unlock that full potential that we all have. collecting this information from dental and biological decoding, learning a lot from our ancestors. But we always need to look forward. What is in our future? We don't want to be stuck in the past, rethinking, revisiting the past. We want to move forward and we want to go towards that future. So we need to become aware of what's going on and what we need to work on. We need to be conscious of those conflicts that we need to solve or that we need to move through and resolve. But we need to connect with our essence, and connecting with our essence is connecting with your body, connecting with your heart. Process those emotions, experience them, don't trap them. But sometimes we need help from some flower essences, and I really like homeopathic remedies, and that's what I prescribe my patients for pain and inflammation. But these flower essences are really good for bruxism. For example, cherry plum is a really good one for those that are kind of trying to lose their control. It's like they're getting ready to have a nervous breakdown. So that will be a good one. The cherry plum. Vervain, it's one that is for people that are always on the go. They're always kind of in a high speed, and they want to do things fast, or they want things to be done fast. They become really stressed and tense. So this one will be a good one. The rock water is good for people that are like myself, a little perfectionist. So if we want to have that perfectionism under control, the rock water will be a good one. And patience is good for people that can become irritable, like they get upset and irritable with things. So those are things that can help treat the bruxism while we're processing the root cause of it, while we're processing those emotions. One of the things that I just finished with this workshop, and I will encourage people if you're interested. I'm going to be having it again at the end of the year. It's a workshop to learn more about that, to connect more with those emotions. And I kind of like this title is Whispers and Smiles, because we have the whispers of our teeth. These messages are not loud, they are subtle, and we need to just learn first to discover what it is that they're trying to say to be able to achieve that smile. I have on my website a book, an ebook that talks a lot more about bruxism. So you can scan that. We were having technical difficulties, so if you're not able to access it today, just give me about 24 hours or so to make this work, but you can find it on my website as well. I talk a little bit more about those connections with the teeth and the emotions. So I like this message from Carl Jung. It's like, one does not become enlightened by imagining angels or beings of light, but by making the darkness conscious. And this is what we need to do. We need to get to this light by discovering all this, in a way, darkness that we have in our subconscious mind, and bring the light. We all need this, the darkness and the light, to be able to learn and evolve. So I want to thank you all for being here. I'm sorry I took a little longer than planned, and I'll be open to questions if you guys have any questions. And this is my link tree, so you can find my information there. There are some videos, and there is Dr. Brotto's interviews in there as well. And
I have a question, Isabel. My canine, the right canine, number 6. I've always been very loyal, because that's right. Always, you call me to the lines, as my father would say, and I would be there. And even with my family, I have used lines as, if I was to go to war with somebody, I would be with you.
Oh,
Yeah, I have said things like that. And I didn't understand why. It's just this tooth has always vibrated too much, all the way up to my sinuses. I feel the vibration since I was little. So there's a lot of loyalty, military, got to do things straight. Um, However, lately I have been grinding that side a lot, and I
Mhm,
can't even put my mouth guard on at night because it hurts so much. But I
mhm,
can tell that there's a lot of wear and tear in
mhm.
that tooth. Uh, my idea of it is that I am trying to get rid of that loyalty.
So I know, but when we're trying too hard to do something, we're attracting it even more sometimes.
No.
um, we need to flow with things, and this is kind of one of the lessons I'm learning personally in this life, to flow instead of controlling things and trying to do things.
Mhm,
This tooth is also the tooth of the obedience.
mhm,
So this is a great example of what to do with our body and how to understand the messages. Because yes, the messages is, yes, I'm having loyalty to maybe an ancestor, but what is it that you're loyal to? Not really to the ancestor, is to this memory that is resonating with you, that you need to change or you need to transform in your life. There is a really powerful exercise that I do with the body and any part of your body, and you can even do it with your tooth.
mhm,
And is writing is like, let's say I'm sitting here and I'm going to write a letter to that tooth, to that canine, number 6. I
mhm,
said, I'm feeling all these different emotions that come to you. I'm frustrated. Why is this tooth bothering me? I cannot even put my niger. Everything that you want to say to this tooth, you're going to write it down. And then later, you're going to move to another position and you're going to connect with that tooth as if you were that tooth. And then you read the letter
mhm.
that you wrote to the
Yes.
tooth, right? And then you're going to read the letter as the tooth. And then now you as the tooth is going to write down a response to you, right? So you're going to write that down. Okay, I'm doing this because I need this.
Uh-huh.
And you do this, and then you go to your original position. And then now you read the letter that your number 6 wrote back to you. And then
Mhm,
you're going to become you. So then you're going to read that letter. When you do this exercise back and forth multiple times, you'll be surprised of the information that you're going to get,
mhm,
because you're accessing that subconscious mind. So yes, you are trying to get rid of that loyalty, but what is it that your tooth and your body really wants you to do? So then you ask the tooth, what is it that you need? Or what can I do to help? And then
mhm.
back and forth, you're going to get more information from that subconscious mind, and you'll be surprised of what you get. And that's with any part of your body.
Okay. That sounds really good. I'll try it.
Yeah, it's powerful.
Definitely try it. Thank you. Thank you so much.
You're welcome. The other thing is that I also want you to connect with, and I'll probably share this. Let me see if I can share this right now. Where do I stop this? I don't see my button to stop sharing. Oh, here. Let me share this other screen. So this is something that I use a lot with my patients at the office, because it's important for them to not only see the connection with the different emotions, but also the meridian,
Okay.
because that also gives information. So remember, information is important. And when you look at this tooth, that tooth number 6 is connected to the liver and the gallbladder meridian. So then you go and look at the biological decoding, see what is that connection with the liver and the gallbladder. And then there is a connection also with these other parts of your body, the sinus, the palatine tonsil, the hip, the eye, the
Mhm,
knee. And there's usually on that same side of the body. So your right knee, your right eye, your right hip. But
Mhm.
look at the emotions that are connected. And this is coming from traditional Chinese medicine. So it's anger, resentment, frustration, blaming, incapable to take action, and some feelings of being manipulative. So then you sit with that and see what resonates with
Mm.
you.
Yeah.
And especially before you're having the symptoms, right? So what was happening before you were having the symptoms connected to any of these emotions?
Oh, there's been a lot happening. So, yeah, that makes sense. Definitely the incapable to take action because I have been experiencing chronic pain for almost 6 years.
Mm-hmm.
And yeah, it's all on the right side. And
Mm-hmm.
then year and a half ago, I was under a tree and I just found out that that tree has the bacteria. And I developed a infection in my eye that continues to just stay there. So it's everything is on this right side of the face.
Mm-hmm. And then your right eye, are you right-handed?
I am right-handed, yeah.
Yeah. So then something that you saw that you didn't want to see.
Mm-hmm.
And then bacteria is usually external help.
Mm-hmm.
So it's just information in there to see. But maybe doing that exercise, that letter to your body part,
Mm-hmm.
it will be a really helpful one.
Yeah.
So
Mm-hmm.
I would do it with the part of the body that is causing you the most discomfort.
Mm-hmm.
Start with that first,
Yeah.
right? With the guard, for example, when you're having that, it is possible the teeth move really easy. So
Mm-hmm.
you can have a tooth moved in minutes or actually less. Like when I used to do ortho, there was, for example, a diastema space between the teeth in the front, and I will push them together with my fingers and then put a little rubber band, and then I will remove the rubber band and they will open up. They move really, really fast. So if there is some clenching and grinding, when you're doing the lateral movements, there is movement happening. So it is possible that the mouth guard is too tight,
Yeah.
that is causing that discomfort. So there's two things that can be done. One is you can either ask your dentist to adjust it,
Mm-hmm.
or you can wear it for longer periods of time, meaning that you will not only wearing it during the night, at night, you're wearing it during the day. And that's like Invisalign, for example, the invisible braces, that's what they do. With pressure, they move the teeth. So
Mm-hmm.
what you're doing when you wear it longer, you're moving the tooth into the position that it was before it moved.
Okay. Thank you.
You're welcome.
Thank you.
Yeah, you're welcome.
Can I ask a question?
Absolutely.
Do your can your techniques help somebody get rid of a mouth guard?
It is possible, and there is a lot of success with that. But as I said, you have to do a lot of work because it's layers, different layers that are causing the bruxism, right? So if it's something simple that, okay, I just was stressed out because I was having a really difficult job and now I'm retired and I'm not working, my stress level has improved, and now I can express whatever I want to say. I can just, my anger, if that was the case, is under control. Yes, you probably are not clenching anymore. But
Okay.
that's when the root cause, we need to find that root cause and what it is that's causing the bruxism, right?
Okay.
When you start using the homeopathic remedies or the flower essences, that helps a lot deal with that subconscious mind, because that's the one that is kind of guiding this habit. Is a habit that we're not aware of. It's something that is coming from our psycho-emotional state. So then we just need to start kind of like checking the boxes. Okay, so my anger level is okay, or what was causing the grinding to begin with. And then they just start checking all the different boxes. Once you check all those boxes and treat the different root causes, usually are multiple, not just one, then you'll be able to get rid of the night guard for sure.
Okay.
Wonderful.
A lot of the times also is the muscles, right? Like when we have hypertrophic muscles, like especially the masseters, and they're connecting with the neck,
Hmm.
you start having a more relaxed life. Your muscles are kind of more relaxed, then all those are going to start following, and your contraction is not going to be the same as it used to be when your muscles were all tense. But then looking at, and then when we have the muscles tense, is because what is it that you're feeling that you're not capable of doing, right? Or that potency, that's the muscle. What is it that I'm not able to do? So then just looking at the different causes for the bruxism, it's important.
Thank you.
You're welcome.
Okay. There seems not to have any more questions, Isabel. So
Mhm.
what we can do, if that is okay with you, is put this on the ISPBM
Mhm.
Mind Body Logic YouTube channel, and then share the video with everybody in Mind Body Logic, so they can benefit from this, because there's really good information that you have shared with us. And thank you so much for
You're welcome.
sharing your time with us and your knowledge, your wisdom. It's very powerful.
Thank you for being with me.
Yeah, it was
Have a
excellent
great-
presentation.
Yes, very helpful. Thank you.
Thank you so much, Isabel.
You're welcome.
Thank you,
Yes,
everyone.
thank you very much, Isabel.
You're welcome.
Have a good night, everyone. Thank you.
Okay.
Bye. Good night.
Night.
Good weekend.
Yeah, same to you. Good weekend. Thank you again.